Advisor to the Ministry of Health, Dr. Leslie Ramsamy, noted that suicide and all other mental health issues remains a key priority for government, who has been working assiduously to reduce the incidence and prevalence of the disease locally. One of the most transformative changes came in 2022 with the passage of the Suicide Prevention Act, which decriminalized attempted suicide. The law removed a major barrier to help seeking, reducing stigma, and aligned Guyana with the 2023 Bridgetown Declaration on Mental Health.
This has been a mantra that I've spoken about, that suicide narratives need to be changed. The changing narrative, because in the past, in the 1990s, early 2000s, we spoke of suicide as if it was people's fault. And that's why we had the criminalization of suicide. We spoke about it that people committed suicide. We have never heard about anybody committing diabetes or committing cancer or some things like that. Mental health is a real factor in suicide and in suicide prevention.
The National Suicide Prevention Commission was also established, bringing together government, civil society, faith groups, and indigenous leaders. This progressive law establishes a whole of government and whole of society approach, mandating the creation of a multi-sectoral National Suicide Prevention Commission. In April 2024, the government further strengthened these efforts through the launch of the National Mental Health Action Plan and Suicide Prevention Plan, built on 6 pillars, including expanding training, strengthening surveillance, restricting access to means, and widening service access across the country. The results are already tangible. In May this year, Guyana launched its first 24/7 toll-free National Suicide Prevention Helpline, 915, offering crisis intervention and confidential support. Dr. Ramsamy says this service is saving lives daily. The Pan American Health Organization and World Health Organization have since recognized Guyana's significant decline in suicide rates, praising the country's integrated and compassionate approach. While these initiatives have been extremely successful, Dr. Ramsamy is reminding that it takes the commitment of the entire nation to eradicate suicide.
And I'm going to urge people that we all must do our part. We never know when mental illness, we never know when depression, when the sense of feeling lost will happen to one of us or to one of the family members. And therefore, it should be all of our business. This is not about politics, it's not about religion, it's not our status in society, because it affects the rich, it affects the poor. And therefore, it has to be all of our business.